We appreciate your coming and also appreciate the support you have been given over the years, especially in 3 areas. One is the HIV program through DHAP, which has been going for care and prevention for some years. We shall have a presentation from Lieutenant Colonel Ivry when time comes. We also have had the APRAP trainings, capacity building, and in the following areas we had the trauma nursing care, medical evacuation, medical modeling and simulation, and tactical combat care. This was between August 2018 to January 2020. And in addition, we received the 2 field hospitals. One is deployed in Somalia and also another one is in Jinja for training. We use it for training. We have also been supported by sending our experts to attend the APORA meetings since I think 2018. I attended the first one from Liberia, and every year we have been sending a delegation of 2. This has helped us in building capacity for the detection, prevention and response to epidemics. We shall have a presentation on response to epidemics, how we support the ministry here, and he will take it. Then also we shall have a presentation on capacity building and capabilities of the hospital by the CEO.
The reason I wanted to come here to Uganda was to first and foremost to thank the UPDF for the great relationship that you have with our American healthcare forces, the U.S. government, and I know that the UPDF is 25% of the force is deployed at any given time. Your role in the regional security here is incredibly important. It's a major priority for America to have geopolitical stability on the African continent, and the UPDF, whether it's working to suppress and fight Al-Shabaab or ISIS, those priorities that we share are so incredibly valuable, so we thank you for that. And I always look at healthcare as a great opportunity for collaboration and a great opportunity to elevate our communities by talking about how we can help people, which is something that I think is a universal human value. And so when we do that, it sort of melts away a lot of the political, sometimes barriers. Sometimes they're internal politics. We have internal politics, everybody has internal politics, but healthcare is something that is a great bridge amongst both, within our societies and our organizations and across borders. And so the ability for us to collaborate with healthcare is really a tremendous form of partnership. And we talked a lot about whether it's global health security, forest health protection, disease surveillance. Those are all things that are as important to us as they are to you. And so to the extent that we can continue the great work that has been done and continue to build on it and potentially grow on that work, we're very excited and eager to try to continue to do that.
Hello, Dr. Ronald Nangamba. I'm the Chief Executive Officer of this facility, the UPDF National Referral Hospital, a 380-bed capacity, multi-specialty tertiary level of care hospital, a facility that is soon to be commissioned, and a facility that comes as a welcome addition on the national health care infrastructure, a facility that will be utilized by both the military personnel and defense employees, but will also be open to the general public. And given the level and the standard at which it has been constructed and equipped, we also anticipate that we shall have referrals coming in from the neighboring countries. A lot of work has been done by the UPDF and the Ministry strategic leadership to come to where we have come. We are in the last mile, soon to have the facility commissioned for use. The facility will offer a number of services, a wide scope of medical and surgical services, including general medicine, internal medicine, pediatrics, surgery, obstetrics and gynecology, and the subspecialties that are in. For example, surgery, we shall have ENT, neurosurgery, orthopedics, ophthalmology, and many other subspecialties offered at the national referral level. In the future, which is to come as the second phase of the construction, we are going to have an oncology and cardiac unit, and so we shall be able to have a whole spectrum of oncology services and cardiac services, including cardiac surgeries, including a bone marrow transplant facility. All these will be incorporated in the package that the hospital shall be offering.